Good morning. I'll probably be the last person able to wish you a good morning, but I'm Spencer Turnbull, OIG's Heat Initiative Administrator. Before I was in this role, I was also in OIG's Office of Counsel, providing guidance on the healthcare fraud laws to stakeholders in the healthcare industry, particularly on the anti-kickback statute and how that law applied to real-world business arrangements. And I also worked as a prosecutor on the Medicare fraud strike force in Los Angeles. So I've spent time at the intersection of explaining and interpreting the healthcare fraud laws and also applying those laws in a law enforcement setting. It's been an interesting vantage point, and I hope that the upcoming speakers will make a similar connection for you. So first I'm going to give a brief introduction to our law enforcement partners. Then our panelists are going to describe some of what they're doing to get ahead of fraud, what types of investigations they're seeing, and explaining how cases are chosen for prosecution. When you've heard from each of us, we'll be available to take your questions after the panel concludes. So as Meredith mentioned in her introduction, OIG is a partner in HEAT. That's the Healthcare Fraud Prevention and Enforcement Action Team. It's a joint initiative between the Department of Justice and Health and Human Services designed to marshal significant resources in the fight against healthcare fraud, to crack down on fraud perpetrators, and to enhance existing partnership between all of these agencies. Medicare fraud strike forces, as you heard a little bit about, are an essential component of HEAT. And although there may not be one operating in your region, you're likely to have heard about some of their accomplishments in the media over the last years and months. A Strikeforce team is comprised of DOJ prosecutors, assistant United States attorneys from local U.S. attorneys' offices, FBI agents, OIG agents, and other state and local law enforcement. And they're backed up by data analysts who use data from our partners at CMS to help pinpoint fraud hotspots. So as all these Strikeforce constituents that I just named suggest, we have a lot of partners across government in the fight against fraud and abuse. And as James alluded to earlier, all of these acronyms can turn into an alphabet soup if we don't take the time to kind of explain who we're talking about. So that'll be the last thing I do before we get to our panelists. The Department of Justice, or DOJ, represents the government in the prosecution of civil and criminal cases in federal court. The Department of Justice includes United States attorneys' offices in each judicial district, as well as attorneys who work here in Washington, D.C. The Federal Bureau of Investigation, or FBI, is a component of the Department of Justice that enforces criminal laws, including the healthcare fraud laws. At the state level, state Medicaid fraud control units, MFUCUs is that acronym, focus on Medicaid fraud in 47 states and here in the District of Columbia. And CMS has a role in combating fraud and abuse too. The Center for Program Integrity serves as CMS's focal point for all Medicare, Medicaid, and Children's Health Insurance Program fraud and abuse issues. And then finally, state attorneys general's offices enforce any state fraud and abuse laws. All right, so let's get to our panelists. We are fortunate to have representatives from several of those agencies that I just mentioned here with us today. First, you'll hear from Dr. Peter Bedetti. Dr. Bedetti is Deputy Administrator for Program Integrity at CMS and Director of CMS's Center for Program Integrity. He has principal responsibility for program integrity policies and operations in the Medicare and Medicaid programs. Before joining CMS, Dr. Bedetti worked in a number of healthcare positions in government and the private sector, including service to the House Subcommittee on Health and Environment and the Senate Finance Committee. In his academic life, Peter has founded and directed health policy research centers and held a number of professorships. Next, you'll be hearing from Nick DiGiulio. Nick is a special agent in charge of OIG's Philadelphia Regional Office, supervising HHS OIG investigations in 5 states in the District of Columbia. Nick began his law enforcement career with OIG in 1988, and since that time he served in a number of capacities, including law enforcement instructor at the Federal Law Enforcement Training Center and the Inspector General Criminal Investigator Academy. John J. Pease has served as an assistant United States attorney in the Eastern District of Pennsylvania since 1997. He's the Chief of Government and Healthcare Fraud and Environmental Crime Section, and his responsibilities include supervision of all criminal prosecutions in the area of healthcare fraud, procurement and program fraud affecting U.S. government agencies, environmental crimes, and crimes over which the FDA has jurisdiction. Mr. Pease is also an adjunct professor at Drexel University's Earl Mack School of Law. Next, you'll hear from Jacqueline Franklin. Ms. Franklin is a supervisory criminal investigator with the Medicaid Fraud Control Unit here in Washington, D.C. Ms. Franklin investigates allegations of fraud committed against the D.C. Medicaid program, as well as allegations of abuse, exploitation, and neglect of vulnerable citizens. Ms. Franklin has more than 21 years of experience with Medicaid-related matters, with 14 years in investigating civil and criminal cases, including as the chief investigator in D.C.'s Mafuku and as a criminal investigator and program analyst for the state of Texas's Mafuku. So these folks are the real deal. They're a great panel, and I'm going to get out of the way and let them tell you about what they do. Dr. Bedetti, would you start us off, please?